Okay, I'm sitting here with Dr. Ranger and I'm about to get my blood tested. Okay.
Just relax the finger. So it didn't spread that well, so that means it might be aggregated.
Yep.
So you have quite a significant oxidation in the blood. I'm just going to check the whole sample. Let's find the best area.
Yep.
So the whole sample basically looks like oxidized. All the cells are highly aggregated. Okay.
So what sort of things do you look for?
So we are looking at low magnification. The cells are all aggregated, clumping together. So that shows high levels of oxidative stress.
Yep.
Coming from the chemicals dumped into the blood. So now we look at it higher magnification. You see the red cells all clumped together. This is called rouleau formation.
They're like slinkies.
Yeah, exactly. And there's no space or area for surface area for oxygen to penetrate.
Okay.
Another thing you notice is that the neutrophils, this white blood cells, very small, same size as a red cell.
Mm-hmm.
And the lymphocytes also very small. This is a very high aggregation. So and the cells that are separate have a bright center in the middle. That's what they're called target cells or annulocytes.
Mm-hmm.
And that means its cells are oxidized. Inside, the hemoglobin is oxidized. Like that.
So that's not good.
No, so you'll see that once the cells disperse, you'll see quite a few of those cells in there. Again, the white blood cell, very small. Okay, so you do want to take some recovery and try again. Bring some water for you.
Okay, I'll just turn this around while you do that.
Okay.
Hey guys, okay, so you've had a look, you've seen that my blood is what it is. So what we're going to do now is these are called Recovery 7.2, and I'm going to take a couple of these now, and then we'll retest the blood in about 5 minutes, okay? And then we'll show you the result. Alright, so this sort of. There we go. Hey. Alright, so here we go. Dr. Ranger's going to get me some water, but I'll just take a couple of these. I'll just take 2.
So you're going to take 2?
Yeah, is that what you recommend?
Maybe take 4.
So
Ideally, 4 would give you better.
I was going to take 2.
Depends on how bad the cells are.
We'll go with 4. Okay, so here we go. Just taking these 4 now, okay?
We'll give it a couple of minutes. And just to check, what other supplements do you take other than
Just the Protandim.
And no other supplements? Yeah. Okay, so that explains why even though you were taking Protandim, but you stopped the recovery.
Yep.
The heavy metals and other chemicals coming into the blood, there's nothing to bind it or chelate it.
Yep.
So what the recovery does is it releases the negatively charged hydrogen with electrons, and these electrons can neutralize the free radical, but cannot get rid of the cause, which is the heavy metals.
Yep.
And same thing with Protandim, it increases the enzymes. Some of it is glutathione, which can bind, but not enough probably.
Yeah.
So at the moment it's releasing a lot and affecting the blood. So we will just the second one.
So in the results that you've tested with the recovery so far, have you noticed different results with people, or has it always been fairly consistent?
If the blood is oxidized, very, very effective in dispersing, but in terms of patient response, quite a remarkable feedback for pain relief to a lot of different responses.
Yep.
Okay, so we take second drop.
Okay.
Take a different finger. First droplet is taken out because it's damaged from the puncture. So allow the second droplet to come out without squeezing too much. So
I imagine cleanliness would be fairly important.
Yeah. How it spread.
I saw that actually, yeah.
It spreads quite nicely, so compared to the one before, which kind of starts
lay them
spreading a
side.
little bit.
Do you want to put them together just to show the difference?
Cool. Still spreading.
Yeah.
Low magnification again.
Oh, you're kidding.
As I said, see, quite a lot of cells have that target structure now that is dispersed.
Yeah.
Look at the white blood cell size.
I know.
It's expanded. Looks really good.
So what's that shadowy stuff between the cells?
These are platelets.
Oh, okay.
Clotting factors.
Yep.
And this is a lymphocyte, white blood cell that was the size of that, so it's starting to expand. See this size of that?
Yeah. So, going from where we were before to what we have now, what sort of benefits are there to the
immediately
person?
Oxygen penetration. Now the cell has all the surface area for the oxygen to go in.
Yep.
Once it goes in, if you don't have those target type of cells, it will bind to hemoglobin properly.
Yep.
So you have higher level of oxygenation of blood and other tissue through the blood. So this is excellent.
Yeah.
Huge difference.
And that's like in under 2 minutes.
Yeah, less than 2 minutes.
I know.
Yeah. And if you leave it 5 minutes, it will be even better. Yeah. The movement of the cells is not because the red cell can move, but it's just the fluid. If I took a larger quantity of blood, you'll see more movement.
Yeah.
This is just...
I'm amazed.
yes, correct. So I've tested over maybe 300
Yep.
patients with highly aggregated blood. Within 2 minutes, it's gone. And in this case, it's mainly, I think, the dumping of all the heavy metals and other chemicals into the blood, and the liver not quite fast
Processing.
enough. So,
Okay, so with my plan to go into an alkaline diet with a high levels of greens and a detox process, that should see an overall increase in health, fatty, the liver processing a lot more fats, which means probably lose a bit of weight.
The released from the fatty tissue will be cleared quickly, detoxified quickly.
So the heavy metals
will be cleared. You need to have, maybe you can add something like chlorella to the greens. Well, we don't have the chlorella and spirulina in there because of the detox. So now you need the detox, you can add it to the mix, and then that should clear the heavy metals of the system.
Okay, cool.
Yeah.
All right, thanks very much.
Thank you.